Hi, welcome back for your EMT Chapter 2 lecture. My name is Marcy, and I'm going to be doing some of the lectures for you throughout this course. Today's topic is going to be well-being of the EMT. We're going to go through several topics today, including well-being of the EMT and how to take care of yourself, personal protection, diseases of concern, emotion and stress, and scene safety, which is one of our primary concerns in EMS. As we look at the importance of the well-being of the EMT, we have to look at different areas. And so we think about being prepared for all of the demands and risks. And that is both the physical demands, the emotional and mental demands. So as we move forward, we're going to talk a little bit about ways that you can better prepare yourself to endure the longevity of this career. If you're unable to function for any reason, your patient may not get the care that they need, or they may not get good care. Our patients really need us to be present at each call with each moment and trying to help them, again, from that emotional support standpoint, but also from that physical standpoint. And if we ourselves are not well, it's going to be really difficult to take care of those patients. So when we think about maintaining well-being, we have to look at a couple of different things within our personal lives. So thinking about this, we have to understand that our relationships with others is going to be extremely important. And that's not only with our personal relationships, maybe with family and friends outside of work, but also with those professional relationships. We have to be able to communicate well with our partners. We have to be able to go home and continue our, we say, normal daily life with our families. And so how do we balance that, and how do we keep those individuals, supporting us and moving forward with us without compromising those relationships? Exercise is going to be extremely important as well. Our job as an EMT or EMS professional means that we have to be both physically and mentally capable to do the job. And with the job that we have, we may be going into areas that we're unfamiliar with. We may be having to walk up several flights of steps. We may have to crawl down into a ditch. So if our bodies are not physically able to do these things, then we can't perform the job. Sleep is important, and we understand that an adequate amount of sleep is extremely important in order to be able to function efficiently. And what I mean by that is we have a lot of areas where we could make mistakes. And if we don't get adequate sleep, if our minds are not mentally sharp with each and every call, medical errors can be made. Driving accidents when we're driving the ambulance could be made. There can be a lapse of judgment, and that's something that we need to be paying particularly close attention to, because it's not just our well-being that's at stake. It's our partners. It's our other professionals around us, fire, law enforcement. It's also our patients. Think about eating right. We like to eat on the go, things of convenience, right? Everybody's busy these days, and we understand that. However, we've got to be able to nourish our body from the inside in order to keep it functioning well on the outside. And although we all have those times when it's just easier and more convenient to hit a drive-through, we need to balance that out a little bit. Again, keeping ourselves healthy as a whole and not just in one area. Now, limiting alcohol and caffeine intake is also mentioned here, because alcohol can be used as a crutch. Some people will use alcohol to help them to deal with the stressors or the situations that they've been presented with in EMS. And please understand that it's not saying that you cannot consume alcohol or caffeine for that matter. However, you've got to do it in the constraints of not becoming dependent. We know that sometimes caffeine is used to help keep us awake. We think if I take some caffeine, drink some coffee or an energy drink, then that's going to help to keep me awake. Well, that may be true, your eyes may be open, but your decision-making skills and your reaction time can still be impaired. We look at your primary care provider or your physician as someone who helps to take care of you on that personal side of things, and they are looking out for your best interest as well. It's important that you see these individuals regularly. I know some people go for yearly physicals, some don't go that often. However, if you have a problem, this person is going to be able to help you work through it. And this individual also makes sure that you are up to date on your vaccinations, that if you do develop some type of medical condition, high blood pressure, high cholesterol, that you can manage it so that it doesn't cause you further damage to your body. All right, we're going to talk a little bit about standard precautions now. And when we mention standard precautions, you're going to hear this kind of throughout your EMS profession. But we're really looking at our ability to prevent our own infection. And we talk about bacteria, we talk about viruses, and there are different ways that these things can get into our bodies and make us ill. So the standard precautions are just ways to prevent us from becoming infected, if you will, with these organisms. So pathogens can get into our body in numerous ways. Some are bloodborne, meaning you actually have to touch blood or body secretions in order to get it. Some are airborne, meaning you just have to be in a room where someone is coughing or breathing and you are at an increased risk to get that infection. But these standard precautions protect us from those pathogens. And if you think about the back of an ambulance, you're in a pretty confined space here. And the individual that we're working with, we are in real close proximity with. And keeping ourselves protected and the well-being of the EMT, again, is our primary concern here. We do have to make decisions about which standard precautions we want to use based on each patient. When we decide what we're going to use in order to protect ourselves, this is really a very individualized decision. So we have to have an idea of what we're dealing with this patient. Do we have a lot of blood? Does the patient have a cough? Are we likely to need to suction this patient's airway? Is the patient vomiting? All of these things will help to make that decision for you on what type of personal protection equipment we need. Now, personal protection equipment and BSI, or body substance isolation, those terms will be used kind of interchangeably probably throughout your career. So just to understand, the PPE or the BSI really is the same thing. We have different regulating bodies out there that govern how we in EMS practice or how patient care should be delivered in general. OSHA is one of those organizations that really helps to ensure that we are able to have the equipment that we need to protect us in the job that we are doing for our employer. So OSHA, the Occupational Safety and Health Administration, they will help to decide with your employer, these are bloodborne pathogens, this is how you can protect your employees, and if your job puts you at risk, then your employer is responsible for providing you with that protective equipment. We also have some local protocols for what we are to wear in certain situations. You will find now with COVID that we are doing a lot more as far as wearing N95 masks, those personal respirators, to prevent those droplets and airborne type infections. There should also be written policies that will help us to decide if it's a particular infectious substance, what are our basic standards that we need to utilize. And when I say that, understand that some of these infectious substances are transmitted different ways, and therefore if it's been recognized, if we already know what we're dealing with, then it's written that certain measures should be taken. However, in EMS, many times we do not know what we are really coming into, and that does not mean that you should be covering yourself from head to toe, but it does mean that if the patient is coughing after you arrive, then you're going to step it up. You're going to take those extra precautions. Again, thinking about those airborne infections that could be potentially life-threatening to you. This is just an image of some of the PPE or personal protective equipment that we may be able to utilize in EMS. We're going to go through some of these and kind of talk about when is probably most appropriate for you to be using them. Primarily, you're going to see a lot of protective gloves. Understand that not all gloves are created equal. Most of our gloves are vinyl or other non-latex types of gloves due to the latex allergies that some of our patients have developed. We need to make sure that we are wearing a new pair of gloves for each patient, because cross-contamination is also a concern in EMS, especially when we have mass casualty events, or if we are at an event where we've got more than one person and we're just trying to triage or evaluate more than one individual. So changing out our gloves is going to be important. Also understand that there are more heavyweight and tear-resistant gloves depending on what we are doing. Now, we look at not only taking care of our patient, but keeping us well, and so there are different types of gloves for different jobs. Just be familiar with what's available to you, and again, when you're seeing these gloves, our vinyl or non-latex gloves are usually used for patient care. When you look at this image, understand that there is a technique for removing gloves properly, and this is just so that if there is blood or other soilings on the glove, that we are not spreading that around. We are able to kind of contain it within the glove itself and keep others from being contaminated as well. So you will see the individuals pulling off one glove, placing it in the palm of the other glove, and then again pulling the next glove off. These gloves are inverted, so they're turned inside out as you take each of them off, and then again by placing the first glove in the palm of the hand of the other gloved hand, when you remove it, you just create one small kind of ball of vinyl or non-latex to throw away in the garbage. And the soiling is on the inside of that, protecting others from potential exposure. When you look at this image, understand there is a technique for removing gloves properly so that you are not contaminating other surfaces or other individuals or your own hands after removal. When you remove your gloves, you are going to remove the first glove and invert it or turn it inside out. You're then going to place that glove in the palm of your other hand and again invert that second glove over the first and inside out. That's going to contain any blood, bodily fluids, contamination of any kind that's on the surface of those gloves. This way we are not touching other surfaces, our hands or other individuals do not become contaminated with that material. Now, it's really important that you change your gloves out if they become visibly soiled. If you are moving to a new patient or another individual, And also think about cross-contamination. So if you have your gloves on and you've been working with a patient, do not reach into your pocket to get your pen, because now your pen is contaminated with whatever substance was on the gloves. Even if they are not visibly dirty, there may be infectious material on those gloves. So it's important to remove those gloves if you are touching a door handle, if you are manipulating equipment with inside the rig that you do not need to have the gloves on for. And then after your call with this individual, after you've dropped them off to the hospital or wherever their destination might be, it's important to go back through and wipe down the inside of your ambulance, including any surfaces that you may have touched with those gloves on. Cross-contamination is a real issue, and it's important that we remove our gloves and put on clean gloves appropriately. Please understand the importance of hand washing. Hand washing is your primary way to keep yourself protected from infection. And when I say that, yes, gloves are absolutely important, but gloves can fail. And even though your hands may not be visibly dirty, you can have that bacteria or that virus or whatever from that last patient on your hands without realizing it. So wash your hands vigorously with warm water and soap. Do this each and every time you are at the hospital or at your post and you have the capability to do it. We don't have sinks in the ambulance, and so we use those alcohol-based hand cleaners or hand sanitizers. These are considered to be effective by the CDC. These are recommended for use in the back of our ambulance. They are typically alcohol-based, but please know that soap and water is your best defense. And there are some illnesses out there that our alcohol-based hand sanitizers do not kill. So warm water and soap is going to be preferred. Just remember, each and every time you take gloves off, you should be cleaning your hands in between with either hand washing or alcohol-based hand sanitizers. It's important to protect your mucous membranes as well as your hands from any bodily fluids from the patient or potentially infectious materials. So protecting your eyes and your mucous membranes of your mouth and your nose are going to be important here. Particularly your eyes, they need to be protected from the front and the sides. If we have splashing, splattering, or spraying of any bodily substances and it gets into our mucous membranes, we have a higher risk of transmitting or getting that infection. With eye protection, please note that it's not just the front lens that we need to have, but we also should be having a side guard on the eye protection that we are wearing. This means that normal eyeglasses are not good eye protection. Many of the lenses are quite small and do not have the side protection that is warranted in these situations. Again, we mentioned a little bit about having different types of gloves. We also have different types of masks. Now, masks should cover your mouth and nose, and depending on what situation we are in, we may need to use a mask that filters more particulate than others. So if there is blood or fluid, any type of surgical mask will usually work. However, with COVID, with tuberculosis, and with some of those other airborne type illnesses, we need to have a mask that is going to filter particles more efficiently. So an N95 mask or high efficiency particulate air respirator, or HEPA filter basically, is what we're looking for. And this is a mask that is particularly approved by the National Institute for Occupational Safety and Health, or NIOSH. If you don't have a NIOSH approved mask, if you've ordered one from China, it probably doesn't meet the standards that are truly needed to keep you safe. So again, your employer, whoever you're working for, should be supplying these particular types of masks to you if it is a risk that you're taking in your job. Face shields are also available, but please understand the big plastic face shields that some of you may have seen individuals wear, or maybe you've worn in the past. These do not have the filtration or the particulate respirator approval. This is just a plastic shield to protect from splattering. When we talk about those airborne illnesses, again, you really need something over your mouth and nose to filter the air as you breathe it in to protect you from becoming infected. There are several different NIOSH approved N95 style masks. This is one you may hear referenced as a duckbill. There are many others, and you will find that these are much thicker than a normal surgical mask. When we meet in class, we'll have some examples for you to be able to view so that you become a little more familiar with them. But N95 masks particularly need to be fitted appropriately. And what that means is if you have a small face or a large face or you have facial hair, if you do not get a good seal around these masks, they're not going to work as they are intended. So this is something that, again, we'll kind of show you and walk through a little bit so that you are familiar with it prior to pushing you out there into the workforce. You can see this medic is suctioning a patient. They have gloves on, fantastic. They also have a face mask with the shield. So this is a surgical face mask. It's going to protect them from any splattering, spraying from body fluids, and it also has the face shield attached to it. This will provide some protection across the eyes. Again, it wraps around to cover kind of that peripheral or side angle as well. Some face shields are single-piece plastic face shields that cover the whole face that do not have the mask attached. These actually do. So think about the different types of equipment that you have at your disposal and which ones are most appropriate for each patient that you're caring for. Yes, and even some situations require gowns or covering for our clothing. Some situations might be very bloody, should the individual have an arterial bleed. Maybe they are having a baby, and so you have amniotic fluid and blood and other body substances that might be around. Or if we've got multiple injuries and we're trying to do a lot of things, it's important to keep our personal clothing covered and our bare skin covered so that, again, it does not become contaminated with these substances. Gowns are one of the ways that we can do that. Most gowns will have elastic cuffs. You would put that on and then put your glove on so that your glove covers the cuff of the gown, again, providing you with full protection of your hands and arms while you're performing the duties you need to do. Now, it also is something to think about that we have full body suits, Tyvek suits, and gowns that are made out of different material. So use what is most appropriate for the situation. Our clothing and our bare skin, is something that we need to protect. And if you're at a 12-hour shift, you don't necessarily have another change of clothes. Sure, we can wash our bare skin with soap and water, as mentioned before, but our clothing cannot be worn to the next patient or on the next call if it's contaminated. So be sure to cover up if need be with those personal protective equipment items. We're going to talk a little bit about infectious diseases and the diseases of concern for EMS. Now, obviously, there are many out there, and we're only going to touch on a few, but these are the ones that we need to pay closer attention to, and in the world of EMS, they really are our biggest life threats. So hepatitis B and C are two of the types of hepatitis that have been identified. There are several others, but these two primarily play a higher risk to EMS professionals. Now, hepatitis B and C are dangerous because they are highly infectious. These viruses can live on a surface, a countertop, a cot, for several days in dried blood. So that means even if the day before there was a patient that was transported in your ambulance, if the ambulance was not wiped down or cleaned appropriately and all those surfaces were not disinfected properly, then you or your patient the next day may still be able to be infected with that hepatitis B or C. So that makes it pretty scary. Hepatitis B is deadly. It has killed hundreds of healthcare workers each year. We talk about, accidental needle sticks in the hospital setting and even in the field with EMS. But please understand, it's just a matter of this tiny, tiny microscopic virus getting into your body and taking hold. Hepatitis B does have a vaccine, and you are encouraged to get it if you have not already received it. It is part of the Illinois State Public School recommended childhood vaccination list. Now, hepatitis C is very similar to hepatitis B. It causes the same or similar inflammation of the liver, and it has no vaccine. Hepatitis B and C can lead to lifelong issues with the development of cirrhosis or liver cancer. And again, this is not something that you want to put yourself at risk for. So be sure that you are wearing your PPE products appropriately, and that after you care for a patient, that you are cleaning the ambulance and all of your equipment appropriately to prevent further contamination to yourself, your partner, your other EMS professionals, or to other patients. Talking about tuberculosis, if you are unaware of tuberculosis, it's because we don't have large numbers of individuals with tuberculosis here in the United States. This is an infection of the lungs. It is highly contagious and it is airborne. So I will tell you that this individual is usually coughing, or during their talking, giving you a history, they have the potential to be spreading that tuberculosis in the air. Please understand that this is part of the patient's history that they should be providing to you. But if you have someone who is coughing up blood, who is having night sweats, who is having fevers, please put a mask on them. When it comes to tuberculosis, again, and knowing that this is contagious and airborne, it's not just about putting a mask on us, but also placing the mask on the patient to try to minimize the spread. Tuberculosis is a disease that we do find around the world and higher concentrations, especially in the poorly developed countries, in areas where we have a lot of people living in a small amount of space. Places like prisons are one of those areas where we might find higher tuberculosis infectious rates. So we do have, law enforcement, prisons, jails, whatever in our area. So if you are working or going to one of those facilities, just keep this in mind, that there is the potential for tuberculosis. If you have ever had the TB skin test or the QuantiFERON Gold blood test, those are the tests that we use here to determine if you have tuberculosis. And then they can also do a chest x-ray to determine if that tuberculosis is active or dormant. Active meaning you're able to spread it readily. Dormant usually means that it's kind of encapsulated in the lungs and that you're not going to be infecting other people. However, don't take the risk. If your patient tells you they have tuberculosis, put a mask on them, please. We talk a little bit here about AIDS. So HIV, this is going to attack the immune system, and the immune system, remember, is what fights infection in our bodies. So that being said, HIV will basically set you up to get other infections, pneumonias, and things of that sort. AIDS, however, is a set of conditions that result after you've had HIV, and this is how the immune system is now responding to things. So HIV and AIDS are out there. There is no vaccine and there is no true cure. There are medications out there to manage these diseases, but these individuals are also at a higher rate of contracting other illnesses as well. As we talk about HIV and AIDS, know that again, patients should be notifying you if you are working in EMS and you're going to transport them as a patient. There are no special steps that we need to take to protect ourselves besides wearing our PPE. We do not need to put anything on the patient in these situations, but understand that AIDS is a lower risk for healthcare individuals. Hepatitis or tuberculosis is much higher because of how virulent those viruses are. And any contact with blood is the usual route of infection. So if it's wet, sticky, and not yours, don't touch it. Make sure you have your PPE on to protect yourselves. Covering a couple other specific diseases that we may encounter in EMS. Back in 2014, I don't know how old you all were then, but we had some outbreaks of Ebola. Ebola is a hemorrhagic fever, and what this is the individual develops a fever and they also have issues with blood clotting or lack thereof and bleeding out. So these individuals have a high rate of death and a lack of definitive treatment. What we see in the severe situations with this disease or in the later time frame is we see these individuals bleeding from their eyes, from their nose, from their ears, and so it can be a very scary thing. Again, Ebola is something that we do not see a lot of here in the United States. However, it is very prevalent in other parts of the world, including Africa. Severe acute respiratory syndrome, or SARS. This is what we're dealing with COVID. COVID is a SARS type of infection, and this is spread through respiratory droplets. If somebody is coughing, if somebody is appearing to be very sick, and again, we've got a lot of mucus or they are coughing and we're concerned with those respiratory droplets, put a mask on the patient and wear one yourself. This will again help to decrease the transmission rate. Middle Eastern Respiratory Syndrome, or MERS. This is found primarily in the Arabian Peninsula. We don't see this a whole lot in our country. However, we've got to remember that the world is small. There is a lot of international travel that takes place, and we have people from all over the world coming to our area. We live on kind of a thoroughpass of the United States with 80 and 88 and these major interstates. So keep in mind that sometimes the individuals we're taking care of don't live in our community. They may just be visiting or passing through. The avian flu, this is found in poultry and it can affect humans. However, we don't usually see a lot of transmission from human to human. But this is an upper respiratory type infection. So if you have someone who has pneumonia-like symptoms, they're coughing, maybe they're feverish, this could be an issue where we've got, again, that airborne or droplet precautions that we take and placing a mask on the patient. Influenza is something that we deal with every year. It's been around forever and it changes. There are many strains of influenza virus. In 1918, we had a pretty severe strain that killed between 30 and 50 million people around the world. So we now have a vaccine. The vaccine is created annually, and this is done with help of the CDC and the World Health Organization, trying to calculate which strain of influenza is going to be most prevalent. And then typically the top 3 or 4 strains are used to create the vaccine. This will protect us, hopefully, if those strains are in fact the more prevalent ones. That being said, you still have individuals who will contract other strains, or maybe the strains that they chose for the vaccine were not accurate. So each year, the flu vaccine or the influenza vaccine is different. So infection control and the law. Please understand that EMS personnel and other healthcare workers are at a high risk of coming in contact with infectious diseases. This is the job we do. But remember, we have OSHA and the CDC and these organizations that are here to help keep us safe. They write the guidelines for our employers to follow, saying you need to provide the equipment and the personal protective material needed. Occupational exposure to bloodborne pathogens is not only our responsibility, but our employers. According to OSHA, we have to follow the rules and the policies that are set before us, and our employers have to set those policies and provide us with the equipment that we need. So those agencies that we work for give us the training and the equipment, and they also offer vaccinations. As employees, we have to participate in these training events. We have to use the protective equipment that is available and vaccinate ourselves to keep us safe. We have to participate with our employer in order for this to be effective and for us to really have and do what we need to do. So what are we looking at here? We're looking at infectious exposure control plans. How are we going to address each situation? We are looking at education and training. Some of these may be done in person. Some of these may be online modules. But some of them will need to be done annually. The hepatitis B vaccine, which again I mentioned all of you probably have, and if you haven't, that's a conversation maybe we should have because of the risk that you encounter with EMS. All of our personal protective equipment, think about your methods of control, understand that we have to do appropriate housekeeping and cleaning, so maybe you make sure things are nice and clean prior to your first call, but be sure that each event or each call that you go on puts the risk of potential contamination of your equipment in the back of your ambulance. So wiping things down with the approved solutions, chemicals, and that will help to prevent contamination or further exposure to others. Labeling. Make sure that we have appropriate labeling on the chemicals and things that we are using so that, again, we know this is the material that we need to use to clean up blood or body fluids. This is a material that we use as a hand sanitizer. We don't want to use those harsh chemicals on our hands thinking that they are going to decontaminate or to kill those viruses and bacteria that we may have encountered, because many of them do not work that way. And then there is a post-exposure evaluation and follow-up that needs to be done anytime an individual has had an exposure, whether that's a splatter in the face and they did not have facial protection or shielding on, whether that's a needle poke. Those are situations that need to be followed because of the risk for developing that infection. Some individuals will have ample lab testing, blood draws over 6 months, over a year's time during that follow-up. Some individuals will be given medication to take as a prophylactic treatment to try to prevent the development of that disease in their body if in fact they had a true full exposure. So not all patients are real honest with us, and so the Ryan White CARE Act came into play many years ago, and basically what this is this is to protect EMS professionals. So if we transport a patient and they have potential life-threatening disease, it's detected in the hospital, or it's discovered that they maybe didn't tell us they had it in the hospital, we as EMS providers can find out that individual's history, even if they didn't disclose it to us, if we've had an exposure. This is because we want to be able to provide our EMS professionals with treatment as soon as possible. And if we have an exposure and we can identify that, yes, in fact, this individual had some underlying disease state, then we can start the treatment or the prophylactic treatment with that EMS professional. So primarily we're looking at 2 notification systems here. We've got airborne disease exposure and we've got bloodborne or other infectious disease exposure. So if you have an exposure, it's important that you report it to your supervisor, to your employer, because with that they will be able to track the patient and potentially even draw blood from that patient or follow that patient through their hospitalization, so that if any of these infectious diseases that are airborne or bloodborne are present, the individual, the EMS professional that was exposed, can receive the care that they need to prevent development of that infection. Now, OSHA tells us that, again, we know the severity of tuberculosis and the fact that it is spread through the air, and because of this, we should be wearing those NIOSH approved N95 masks or those HEPA masks in compliance. If we have a patient who has TB, again, putting a mask of this sort on the patient is also helpful to reduce transmission. But we've got to understand that there are other precautions that need to be taken. These individuals should be in a closed vehicle. Yes, that means you're in the back of the ambulance. The doors and windows are closed, right? This, again, increases our risk, and this is why we need to be using those approved masks. But in addition to that, we know that there are other duties or other skills that may need to be performed on this individual. So performing high-risk procedures such as suctioning and or intubation can also increase the potential infection rate of those around the patient. When we are suctioning or intubating, we're getting all of those secretions and potentially exposing ourselves to more. So we need to take extra precaution when doing this. Immunizations are out there to protect you and the people that you take care of. So hepatitis B is one that is readily available and is highly encouraged for all healthcare workers. There are other infectious diseases, though, that we come in contact with. And so making sure that you have your immunizations up to date is extremely important. Regular TB testing may also be required by your employer. Again, this might be done through skin testing or through a blood test. If you have transported patients with tuberculosis, then you may have to go through a period of time of testing as a follow-up precaution. And then think about your local system protocols. These are going to vary, and we work in certain areas, and within the area we work, we may see different recommendations. If you live and work on the East Coast versus the Midwest versus the Southwest, things might be slightly different. So if you go anywhere to work outside of where you're working now, be sure that you update yourself on the information and the recommendations of that community or that surrounding region. Emotion and stress absolutely is something that we deal with in EMS. Stress is inevitable. We are going to be put into some situations that we've never been in before and will never be in again. So we've got to find a way to kind of work through and work past these things. Recognizing the signs of stress is going to be extremely important. We've got to find a way to recognize that we need some assistance or that we need to work through something, and then find a way to do it. Resilience means toughness, and this is our ability to overcome those situations like I mentioned we will be coming across. So EMS professionals deal with difficult situations all the time. This may be death. This may be stress of a mental health patient. This may be because whatever we're seeing at work reminds us of something that we're dealing with at home. And we've got to find a way to understand how that stress is affecting us and how we can overcome it. We've got to be physically and mentally able to respond to each and every one of our patients and make good decisions. Our critical thinking skills are extremely important. Our ability to focus and be efficient with our patient care is extremely important. We work in the world of emergency medicine. So with the stages of stress, the first stage is the alarm reaction or the fight or flight. This is where the sympathetic nervous system becomes activated. Your heart rate likely increases. You might get a little sweaty. Your blood pressure increases. And you're starting to ramp up. Like, what do I need to do? Things are getting intense. During that second stage, this is the stage of resistance. This is the stage of coping. So we kind of come back to normal. We are figuring a way to physically and mentally handle the situation. Hopefully we've got those support systems and those different ways of relieving our stress that help us to resolve that situation. However, if we have continued exposure to a stressor, if we do not have ways to deal with it, we get to the point of exhaustion. We can no longer adapt. And when we can no longer adapt, it catches up with you. You can physically feel ill. You can become seriously unable to perform the duties of your job or even go on with daily activity. So it's important to identify the stages and how well we're able to cope or adjust to these different situations so that hopefully we don't hit that exhaustion stage. So types of stress reactions, this can occur because of a critical incident or because of a buildup of issues, but typically any situation that is going to trigger a strong emotional response puts us in stress. So an acute stress reaction, often linked to a catastrophe. This may be a catastrophe in your eyes, but not necessarily in somebody else's. So don't think that this has a very black and white definition, because again, everybody reacts differently to different things, and your life experiences are what are going to create that idea of a catastrophe to you compared to somebody else. So signs and symptoms may develop very soon after the incident. These may be physical, cognitive, emotional, or behavioral. So pay attention to how you're feeling. This isn't just a, oh, I'm really tired, or, oh, I feel depressed. This can affect you in many ways. Normal reactions to extraordinary situations, this can occur, but again, make sure we're finding ways to work through it. And in some situations, there may be some professional intervention that is required to really help you get to that point. Now, a delayed stress reaction, you've all probably heard of PTSD or post-traumatic stress disorder. This is real. This does happen in EMS. And understand that this delayed stress reaction for different people may take different lengths of time. It may be days, it may be years, it may just be the constant exposure to these things that just finally catches up with you. So a patient may not recognize what is causing the problem. You, being an EMS, have now become the patient. Think about what's happening to you. What is your mood? How are you handling things in your everyday life? Because this, although it's due to our professional experiences many times, it spills over into our personal lives. And it can be very difficult to manage if we don't have the appropriate resources. Cumulative stress reaction or burnout. This is really common in EMS, and it's just because I think we are put out there in the middle of all these very extreme, severe situations, and we are expected to take care of somebody. And as EMS professionals, we are thought to be strong and resilient, and absolutely we are. However, everybody has a breaking point. So we've got to be sure that we're taking care of ourselves. With cumulative stress reaction, many times we see some vague anxiety, some fatigue, we see boredom or even apathy with our patients, and we just don't care like we used to. It's important to understand that every patient is unique, and we've got to give our best to every patient. And even those patients that we find call 911 frequently for what seems like very trivial issues, these can cause our stress levels to increase, and we've got to find a way to deal with them. And again, each patient, each time, needs our appropriate attention and care. So with this, it can progress to physical complaints, that loss of emotional control, irritability, or depression. Again, we might find ourselves displaying these things on the job or even at home. It may present as severe withdrawal, sometimes depression, and suicidal thoughts. If you ever experience cumulative stress reaction, it's extremely important to seek help. If you can identify those stress reactions before you get to this point and you can treat it along the way, hopefully you prevent getting to this severe state. Now again, stress is caused by many different things, and for each individual it may be different, but mass casualty incidents, or MCIs, where we've got a large number of patients and not a whole lot of help, these cases are very stressful because we want to do what's best for everybody, but know that our manpower and our time is very limited. Calls involving infants and children, especially if you're a parent, these might be very difficult for you to handle. Those with severe injuries, those individuals that you relate to. If this is, an athlete or a classmate or someone that you know otherwise, this can provoke more stress and emotion from you. Situations of abuse and neglect. understand that you are all mandatory reporters. And a mandatory reporter is someone that is bound by law to report cases of abuse and neglect. And what that means is you should be notifying the proper authorities should you suspect abuse and neglect. This does not have to be a patient that says they've abused me. It's you putting the pieces together, doing a thorough history, looking at the individual, talking with the individual, and if you have those concerns, you make that report, you make that phone call. But obviously, this can be very stressful because we don't know the end result. We don't know what came of the situation. And we as EMS professionals are not there to be the prosecutors. So even if the abuser is present, that's something we cannot let our emotions get the best of us on. So this creates a lot of stress. And also the death of a coworker. We have had incidents in EMS, in fire, in law enforcement, and we all work so closely together that sometimes, it hits us pretty hard when our own EMS or other first responder family has a loss. It's important to know how to deal with that, talking with the resources available from your employer, talking with your coworkers. Anything that you do to help relieve that stress is going to be especially important during these times. So there are different types of stress, and one type of stress is called eustress. Now, when we think about eustress, and that it's maybe not what you've thought of before, because eustress is actually positive stress. It helps people who work under pressure to respond more quickly, efficiently, effectively. And so eustress, I guess, for some of you may be cramming for the final, a couple days before. It's a positive form of stress that says you better get it done, right? Distress, however, is negative stress, and negative stress can build up. It can be immediate and long-term. And with that, we can actually see physical health issues develop. When we talk about those physical issues, or what the people around us might identify as being abnormal or showing some concern, is going to be irritability, our inability to concentrate, maybe changes in your daily activities, anxiety, indecisiveness, guilt, isolation, or a loss of interest in your work. Please note that all of these things are going to impact your ability to care for a patient. So each chapter kind of has these little think about it things. So if your partner is beginning to show signs of stress, what should you do? As we mentioned, you're likely to see some of those signs of stress because you know your partner and you know what's normal for your partner. So when you identify these, what should you do? Well, why don't you try talking to them? See what's going on with them. See if you can help. Be that sounding board. Just let them talk it out even. If you don't feel comfortable with that, then alerting a superior, maybe a shift supervisor or your director or someone that, maybe so-and-so is not doing so well. You can explain if you've had a particular call or situation that you've identified. That might be helpful to get that individual the help that they need. What possible risk could there be to you or your partner or the patient if stress is left unresolved? Again, your ability to think clearly, your partner's ability to think clearly, to really weigh those safety concerns, to make the best call for each patient, because our ability to focus and process information, the assessment, that can all be skewed if we are under a great deal of stress. So the fact of the matter is our partner being distracted or being under this stress and having it roll over into the work environment could affect your partner, could affect you, and it could affect your patient. Do you have an obligation to act or help your partner? I would hope you feel that way. You should. This is your partner. This is someone who you should care about and want to be well. Again, this ultimately could roll over into your well-being and the safety and care of your patients too. So yes, you have an obligation to talk with either that person or make someone else aware that there is a potential situation. So stress comes in a lot of different ways. We have life changes that occur. Some of these, although they are good, can be stressful. You know, maybe a new relationship, maybe a new baby, maybe you're moving. These things can be good, but they do bring with them stress. So we do have to develop some healthful, positive eating habits, some physical habits such as exercise. We've got to be able to devote time to relax and sleep. Remember how important sleep is. And then change shift or location for lighter call volume if you need to. If we are working, in a very heavy drug area, if we've got a lot of gang violence, if we're working shifts where we seem to see most of that violence, then maybe switching to a different shift. Maybe starting to work in a different community may even be something that we need to think about. When we mention PTSD, I hope you understand that you can't really look at someone and say you have PTSD, right? These are the invisible wounds. These are the psychological traumas that we've endured. And again, not everybody develops PTSD, but that doesn't mean that you aren't dealing with things or that you don't have something under the surface that is bothering you. So these psychological traumas can result from tragic scenes, from calls that you've been on. They can be from experiences that you've had in your personal life. But when we have a stimulus that provokes that type of emotion, we've got to find a way to handle it. This brings up the escape curriculum, and this is just ways that we can try to prevent psychological trauma. We talk about every patient. Every patient can bring with them their own issues or things that we worry about, things that we're confronted with. So we've got to be careful with that. Social support. We've got to have support from our personal life, from our professional life to help to get us there, but understanding what other supports are out there to keep us moving in the right direction. Choice and control. You are in control, and again, it's up to you to ask for help in some situations, but anticipate, especially in those severe circumstances or those very serious calls, that you might need a little extra support. Plan and organize. We have written protocols, but working with our partners, we should have that relationship where we can kind of talk things out and understand if this particular type of situation occurs again, or if we're presented with it, that we have a plan. We have a way to attack it. My partner knows my strengths and weaknesses and vice versa. And then be sure that we're ready every time. They used to say, just take a minute and count to 10, take a deep breath. Well, in EMS, we don't have a lot of time, right? We know we have to move forward and keep pushing and take care of our patients. And this is emergency medicine. So understand that when we have the time, we've got to take it. We've got to be prepared every time to potentially be faced with a situation that's going to provoke some emotion. So critical incident stress management, this is a comprehensive system. This is typically managed or kind of organized by our employers. This helps us to deal with stress. Often we have education and resources available to us that we are made aware of. And if we have a particular incident, there are ways that we can follow up with that situation. One of those ways is through our critical incident stress debriefing. So this is designed to help responders diffuse after an incident. Typically, we are doing this 24 to 74 hours after the incident. We're kind of giving people a little bit of the cool down area, but this pulls in multiple resources. So we might have counselors, mental health professionals that come in and they meet with us as first responders. And first responders, this might include our fire family, our EMS family, our law enforcement families. Everybody can come together just depending on your organization or the situation. And this helps us all to handle the stress and know that you were not the only one there that experienced a similar situation, and that these are the resources that are available to you moving forward to help you to deal with any residual complications or concerns that you have revolving around that stressful event. And yes, working in EMS, people are going to die on us. Unfortunately, this is something that we have to find a way to handle. Know that each and every patient you've done your best for, and that will sometimes help you to handle those situations. But know that there are different stages of dying. These emotional stages include denial, anger, bargaining, depression, and acceptance. They usually go in this order. But not all of the patients will go through all of the stages. Typically in denial, it's, I don't believe that this is happening. It's not real. Anger, why me? Somebody caused it. We're pointing fingers. Bargaining means I need to do this first, or if I do this, will things get better? Depression, we look back especially at our life and things that we wanted to do, things that we wanted to say, and understand that we don't always have the time to follow through on those things now at this point in our lives. So we go through that period of depression, and I wish I could have. Acceptance. Accepting the fact that death is imminent. These are the things that I can do before, but I can't do more, and I have to kind of be okay with that. As we work with patients and we understand that there are these stages of death, know that you may be there supporting, helping the patient as they talk about or go through some of these stages of death. Again, some of them will go through them very quickly. Some of them will not hit all of the stages. We are with our patients for a short amount of time, and so whatever we are being presented with, that's what we need to handle. So recognize what the patient's needs are at that time. Understand that anger is normal, and we've got to be tolerant of that. Now, that doesn't mean that the patient should be belligerent or physical and aggressive, but we've got to understand and maybe give them that opportunity to vent. Listen empathetically. Understand that we don't really know what the patient is going through, but we are here to support them in that process. Do not falsely reassure them. Patients are going to die, and we know that. I like to use the term that I'm going to do everything I can, or we are doing everything we can, because that's not false reassurance. But do I always know that this person's going to die? I don't. All I know is right now I'm doing everything I can. Offer as much comfort as you realistically can. I know this is stress, and depending on the situation and the environment and how things played out, you also have a breaking point. So we need to be there as much as we can, but if we need to call for additional resources, do that. Call for some extra hands, call for some help. Even having law enforcement ride along with you if you need to just gives you that other physical body that will help to not only support the patient, but help support you in the situation. All right, and this brings us to one of our biggest topics in EMS. You will hear a lot of people, especially students as they're going through these courses, talk about scene safety. We are not usually a dangerous profession, and we give you the knowledge, the training and education that you need to do the job of an EMS professional. But it's important that you are aware of the dangers that are out there. Know that not all of them are going to be present at the time you arrive on scene, but that the scene can become unsafe, and that we've got to make sure that the safety of us and our partners are our primary concern. If you are lucky enough to work with a specialized unit, hazardous materials may be one of those areas in which you get specialized training. But the primary rule to maintain here is that you have a safe distance from the scene if there are potential hazardous materials. Many of the vehicles that are being driven on the roadways, they have gasoline and other chemicals in them. If we have the big tanker trucks, semis going down the interstates, or even train cars that are coming through our communities, they have placards on them. These placards are the diamond-shaped cards that you see that tell us what is on them. So we can usually identify those placards from a distance away. We can use binoculars, you can use the zoom on your phone even, but we want to do what we call a windshield survey, and while we're still in the truck a safe distance away, we're trying to identify, is there a hazardous material there, and do we have the resources that we need on scene, and if we don't, let's get them there. There are hazmat crews that are stationed throughout the country. Many of the fire departments have specialized training in order to handle these situations, and those are the individuals that we need to respond with us. These placards have color-coded and pictures on them that will help to identify particularly what material is in them. You may see a fire, you may see a bomb, you may see a skull and crossbones, but based off of that placard and the number, we can identify what that is in our emergency response guidebook. We sometimes call this the ERG book. Being an EMS, we need to recognize that there's a potential problem, and we need to make sure that we are taking appropriate safety precautions. Now, our personal safety comes first. If we rush in and we become a victim, we can no longer help other people. So understand, if you do not have the training, then don't go there. Those individuals with the appropriate training and equipment are the ones that should be responding and actually entering the scene. We do not treat patients until they have undergone decontamination. And when we talk about hazardous materials and the environment, we're going to talk a little bit more later on about how these scenes are set up, in that you have a hot, warm, and a cold zone. The hot zone is the center where the contamination is. The warm zone is where decontamination is taking place. And the cold zone is where EMS is, and that's where we are going to get the patients after they've been decontaminated most often. Here you see that officer kind of doing a windshield survey using binoculars. You can see they're far enough away from those tanks to be able to use the binoculars and identify what that potential substance is. We live in a scary world these days too, and it's unfortunate, but we need to talk a little bit about terrorist incidents. These can be small or large. Understand that, it doesn't matter where you are, that terrorist activities can occur. We've got large events in New York City like the Twin Towers, but there are also much smaller terrorist types events that occur throughout our country on a pretty regular basis. So these terrorist incidents may include chemicals or biological agents, radiation, weapons, or explosive devices. When we in EMS work in these incidents, we've got to understand that Sometimes there's a primary issue, and then again, sometimes there's a secondary blast or a secondary exposure, and that may be what the terrorists want. In those situations, many times it is the first responders that are targeted because the initial blast or the initial incident will occur, and then there will be a long enough pause before the second to allow those first responders to arrive on scene. So again, we've always got to keep in mind, is the scene safe? Has the scene remained safe? Is there anything we should be more suspicious about or looking into? Rescue operations. So rescuing or disentangling victims from fires, from car accidents, explosions, and whatnot. This may or may not be something that you are trained to do. Please understand that, again, there's specialized training and equipment that goes into doing some of these things. So we need to evaluate each situation and make sure that we have the appropriate resources. Do not perform these acts if you are not properly trained to do so and you do not have the appropriate protection equipment. Okay, we wear these vinyl or non-latex gloves. If there's a lot of broken glass around, understand that those gloves are not going to protect you from the broken glass. So having a pair of heavy-duty work type gloves is going to be best in the situation to clear away the debris. If we have a patient who is trapped in a vehicle, again, many ambulances do carry a bunker coat. So the fireman's heavy-duty coat, that will be in your ambulance possibly somewhere for you to wear if you need to access that patient. So the realities of well-being in some situations, you will have to make calculated decisions. You will have to be sure that you have the equipment that you need, that you wear the equipment appropriately, and that you take those precautions to keep yourself safe. And sometimes, despite everything you do, bad things will happen and patients will die. The situation will be very uncontrolled and chaotic, but we have to make sure that we have a way to deal with it. Scene safety and the well-being of the EMS provider are determined by the decisions that you make under pressure. And this is again why we've got to be able to think clearly and stay focused. If at any point in time we are not able to do our job properly, we put someone at risk, whether that's us, our partners, bystanders, or the patient. Okay, and let's talk a little bit about violence. So wear safe clothing. We have clothing that is intended for EMS to wear. Now, does that mean everybody needs to go out and buy the expensive pants with all the pockets and whatever, the waterproofing? No, it just means that if you're on the roadway, you're wearing the bright yellow minion color to allow traffic to see you. You have designated on your apparel somewhere that you are EMS so that people know who you are and what you're there to do. Prepare your equipment so that it's not cumbersome. Our cords should not be tangled. We should not be tripping over the straps of the cot because they're dragging on the ground. We should have a portable radio whenever possible. In some areas, we don't use a lot of radios, but we use cell phones. Please understand that if you're in a situation and your hands are tied up, cell phones usually have a speakerphone option on them, so you can always turn that speakerphone on and set it on a countertop or something and talk while you're providing the care that needs to be delivered. And decide on safety roles. When you have a partner or when you have fire and other first responders on your scene, who is doing what? There needs to be a plan in place. There needs to be an understanding of what each individual's role is so that everything is being addressed and taken care of appropriately. Observe. Survey the scene upon your approach. Do that windshield survey. Do not announce your arrival. Sometimes if we know that we're going into a hot or aggressive situation, we want to kind of approach quietly. We may even be told to stage, and staging just means that we're going to sit back a minute while law enforcement or other organizations kind of get things safe for us to enter. And what all are we looking for? We're looking for violence. We're looking for crime scene. Anytime you've got a shooting, a stabbing, an assault, sexual assault, these are crime scenes, and we've got to be very careful the way that we move around and in these areas. Is there alcohol or drugs involved? If the individual is under the influence of alcohol or drugs, it can change our situation drastically. Weapons. What about family members? Sometimes it's really difficult, but think about it. If we have a child watching this occur to their parent from another parent, this can be very devastating. And so let's make sure that we have the appropriate resources. We're moving people away from the situation if we can, trying to de-escalate things. Bystanders, they these days like to antagonize or escalate situations. We get a lot of bystanders who like to pull out their cell phones and videotape things. So let's make sure again that we are moving these people back. We're having law enforcement help us to secure this scene, and we can reduce the number of individuals that are impacted or involved in the situation. Who's the perpetrator? For us, honestly, it doesn't matter. We're going to care for them if they need emergency care. However, we need to make sure that if they are going to be handcuffed or taken into custody by law enforcement, that we have those individuals ride with us in the ambulance, that we do not do this solo, because if they are the perpetrator, if they are the one that committed some type of violent crime, then again, we don't want to put ourselves at an increased risk to become another victim. And what about pets? People love their pets, and there is a difference between a therapy animal and a service animal. Service animals are allowed in our ambulance. Therapy animals, I'm going to tell you, you better find out about your local protocols, because that one is a very gray line. Therapy animals are there to support the patient. I understand that, but they have no true medical need as far as we are concerned in EMS. You see these medics, they're knocking on the door. Usually as a safety precaution, you are instructed not to stand directly in front of a door when knocking or ringing the bell. This is supposed to be utilized in all situations, but I know that you will likely see things that aren't always by the book. Just understand this is for your safety, and this is best practice. Now, if I am standing outside this door and I hear yelling and screaming and fighting and maybe a gunshot, I'm way too close and the scene is not safe. That would be a situation where I would retreat to my vehicle and call law enforcement to come in and handle the situation. If they have a gun, if there is fighting in that going on the other side of this door, I do not have the equipment or the training to handle that situation. So when we need to react to danger, we respond, we radio, and we re-evaluate. So again, if we go up, we identify that there's some danger, we're going to retreat and radio into our law enforcement family, tell them to come, assist us, and then we can reevaluate. And once it has been secured by law enforcement and we are told the scene is safe, we can then enter. Yes, not everything gets to this point where you've got a whole SWAT team involved, but again, if there's potential violent individuals in the scene, in the home, then we need to make sure that we are safe. There are some specialty areas in EMS that are starting to emerge called tactical EMS, and tactical EMS individuals are trained in how to enter some of these scenes. They are provided with protective equipment, potentially including a bulletproof vest, and they are part of that response team even in this violent type of situation. But please note, tactical EMS is a specialty. They receive specialized training and specialized equipment in order to do the job. It is not something that is expected of everyone. Yeah, if there's danger, you need to get out of there. Okay? If you have cumbersome equipment and you are trying to run back to your ambulance, that LifePak 15, it weighs quite a bit. Drop it. I understand it's a machine and it's probably pretty expensive. However, it can be replaced and your life is not replaceable. Take cover and conceal yourself. Our ambulance is typically a safe place to be. Remember, we can drive it further away from the scene if we need to. But stay down. If you can see them, they can likely see you. So stay out of sight. Here you can see them ducking behind some greenery. Again, this is an okay place to be, but obviously the further we can get away from the situation, the more barriers we have between us and the situation, the better off we are. And so a solid wall is going to be better than some shrubbery. We don't typically wear a lot of muted colors, right? Because we want people to see us. So we might have on the yellow minion coat. We might have, red, the Star of Life, and all of that lovely reflective gear on. So understand that they may still be able to see us, and that is why a solid structure is better than an unsolid structure. Some of these chapter reviews are pretty good, and I encourage you to just kind of follow through them a little bit. Be sure that you are reading your entire chapter from the textbook and working through some things in the workbook that's available to you online as well. But know that the well-being is an important concept and you are irreplaceable. We want you to stay protected physically and mentally. We want you to be able to do the job well on all levels. Standard precautions are a serious thing, and you need to take the steps that are required for each situation. Protect yourselves from violence and scene hazards at all costs. Again, specialized equipment, specialized teams and personnel will be there to handle these situations if you are encountering them. Use the proper PPE or BSI. This equipment is there to help protect you from disease. Understand we also have vaccines and lots of other means to keep you safe. And our job is to care for these individuals who are ill, even if they have one of those infectious diseases that we talked about. So you have the education, the knowledge now to protect yourself and be able to care for those individuals without a high risk of exposure. Remember resilience. We have the ability to recover, and that is really important for emergency responders. So in the world of EMS, we've got to be able to physically and mentally recover from each situation that we encounter in order to be able to perform to the best of our ability for the next patient. Stress is imminent, and again, it's going to affect people differently. Different situations will be seen as more stressful to some individuals. Just know you. You've got to keep yourself well, and in order to perform your job to the best of your ability, you may need to ask for some assistance. If you notice others are struggling as well, bring it to their attention. Bring it to your supervisor's attention. The thing we can do is reach out, right? We can get someone involved. If those individuals refuse care or if they do not want support, then that's okay. They may have their own way of dealing or handling with some of those stressors and those situations. But understand that professional resources do not show weakness. You will see death. You will see the reaction to death. You will be there on people's worst days. You will watch their family members go through these crazy emotional roller coasters. Understand that this is the normal part of EMS that you will encounter. Know those stages of death. Be familiar with that so that you know how to best support individuals as they are in or going through these stages. Treat people who are under stress fairly and compassionately. We know sometimes it's difficult to care for someone that we know is the perpetrator or someone that maybe did something wrong and now they're suffering for it. It's not for us to be the judge or the jury. Our job is to take care of them regardless. We want the best outcome for every individual that's there. We are going to provide the best care possible to each individual regardless. So do your job and let the rest get sorted out later. Scenes are dynamic, meaning they can change instantaneously. You are there 1 minute, things seem fine, and the next thing you know, it's getting out of control. We have got to be able to consistently recognize these changing environments and retreat if we need to. Assessment of scene safety is ongoing, so don't be so focused on the patient or on a particular situation. We've got to keep our minds open and continue to really soak in everything that's going on around us in addition to what's going on with the patient. So some questions to think about. What precautions must I take if I'm dealing with a patient who has an open wound? Well, we have an open wound, so there's probably blood. There is maybe a lot of blood, maybe it's a little of blood. Is it spraying? Is it just kind of oozing out of the wound? If we're dealing with an arterial bleed, these are bleeds that spurt. Again, with every heartbeat, you're going to get an increased flow of that bleeding. So wearing a face mask and a shield is going to be appropriate. Depending on the amount of blood, you may want a gown. You definitely need gloves. What can I do to help deal with stress? Recognize it. Do not ignore it. Have a means of dealing with your stress whenever you can, whether that's working out or running or talking to somebody, maybe your dog, I don't know. Take a karate class. Individuals that find ways to help deal with the stress will fare better as EMS professionals, and they will also fare better as individuals in their personal life. A patient who refuses to believe she has a terminal disease is in what stage of dealing with it? If you refuse to believe it, you are in denial. A little critical thinking for you. You are called to an unknown emergency at a tavern. As you approach the scene, you see a man lying supine in the parking lot. Supine means they are lying on their back. Apparently, they are bleeding profusely. 2 other men are scuffling and one seems to have a gun. What actions must you take? First of all, is the scene safe? No. It makes no mention of law enforcement being there. We've got someone who is bleeding on the ground, and although I would love to go over and help them out, there is a gun and there are 2 people who are still fighting. So even if I am not the intended target, I could be hit by a stray bullet. These individuals are fighting, and I am not there to break up this fight either, so I'm going to get back in my ambulance. Great, thank you for your attention. I hope you were able to understand things well. Again, please, it's important that you read the chapter, and if you have questions, be sure that you send an email or you reach out so that we can address that with you.